Hey everybody, this is Dr. Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I am so excited to share this case with you guys because it's a perfect demonstration of two-phase treatment. Now, let me explain two-phase treatment to you guys. All right, phase two is really easy to understand. Well, let's put it this way. Phase one and phase two treatment means that we're breaking orthodontic treatment up into two separate phases. Phase two is the easier one to understand because that's the comprehensive orthodontic treatment. That's where we're looking for a beautiful smile and the perfect bite, and we're really trying to take care of all the teeth and make sure that everything is in the right places and looking great. Phase one, by contrast, happens earlier, and we like to see our patients by age 7 or 8 to evaluate for phase one treatment. Phase one treatment usually occurs between the ages of 8 and maybe 12 years old at the later end. And it has really targeted objectives. So in some cases, we might be trying to resolve really severe crowding so that we can avoid the extraction of permanent teeth later. In other cases, like this one that I'm going to show you, has to do with affecting the growth of the jaws. You see, sometimes there are jaw growth discrepancies that need to be fixed early, because if they're not fixed early, they either can't be fixed at all, or they can only be fixed with jaw surgery. And to say a word about jaw surgery is a surgical fracture of the jaws where there's actually an oral surgeon involved. They're breaking the jaw in a controlled way and resetting it to make the bite perfect. And a lot of times this happens when people have real severe facial disharmonies, like one jaw is very much bigger than the other. It might be an underbite situation, or it might be an extreme overbite situation. But examples where one jaw is much bigger or smaller than the other. All right, well, let me introduce you to Connor. Connor's a great example of two-phase treatment, and I first saw Connor when he was 12 years old. Now, to give you an idea of what was going on in Connor's mouth at 12 years old, if we start out by looking at just this facial photo, there's a severe asymmetry of the jaw. So if you look at the lower jaw, the middle of his chin is over here off to his left side. And meanwhile, the forehead, the nose, the lip, and the upper teeth are all kind of in line over here. And then as we come down, the lower jaw kicks out to the left side. So I knew that there was a jaw asymmetry. If we look closer at his teeth, you'll notice that in the back of the mouth, there's what we call a posterior crossbite. In other words, the lower back teeth are further to the outside, closer to the cheeks than the upper back teeth. And it really shouldn't be this way. When we have posterior crossbites, these are situations that can lead to TMJ problems or jaw joint problems later in life. And so this is a really important thing to fix, especially to fix early. If we look at a different vantage point, you'll notice that Connor also has an anterior crossbite, sometimes known as an underbite. So his lower front teeth are further out in front of his upper front teeth. Anterior crossbites are often results of jaw discrepancies that sometimes are treated best with orthognathic surgery or jaw surgery. So again, this is an indication of early treatment. We want to correct the posterior crossbite early so that we can have the jaw growth normalize and hopefully have healthier TMJ joints. And anterior crossbites or underbites are something that we want to fix early because we want to make sure that we're affecting the growth of the jaws in a positive way. You see, the way that the head grows is that the top of the head is done growing usually at like age 9 or 10. The middle of the face, the upper jaw, is usually growing until about age 12, maybe 13. But the lower jaw grows all the way through puberty. And so in folks that have underbite tendencies, we know that the lower jaw is going to do the most of its growing later during the pubertal growth spurt. And so we want to try to affect that underbite early. If we can give a person with an underbite an overbite early in treatment, then we have a much better chance of success after they do growing later on to make sure that that underbite doesn't come back. All right. Finally, Connor also has impacted upper canine teeth. And what that means is that there's a whole tooth that belongs between this one, and it's up there somewhere underneath the gums, and there's a whole tooth that belongs between this tooth and this tooth, all the way up under the gums. And so we really wanted to try to rescue these teeth sooner rather than later. We know that when teeth are impacted, when they don't have the space to come into the mouth, that the sooner you can create the space, the more likely it is for those teeth to come in on their own, as opposed to later on, you might have to do a surgery to try to recover those teeth and guide them into place. So Connor had a lot of stuff going on: anterior and posterior crossbites, the asymmetry of the jaws with the lower jaw kicking out to his left side, and he also had crowded teeth with impacted upper canine teeth. Now, even worse than all that, Connor already had a phase 1 treatment before I met him. So he actually did have treatment when he was like 8 or 9 years old. That was before I was involved in the picture. And anyway, so what were we going to do about Connor? Well, actually a year passed before we were able to treat him. And so I want to show you what he actually looked like before we started. So here's a picture of his upper jaw. You can see that in the upper right, this tooth is fighting to come in, but it clearly doesn't have space to come in where it belongs. In the upper left, the tooth is also up there looking to erupt, but not enough space to come in right here. If you look at the side shot, you can see that his underbite actually got worse over that year. And this is expected because he was growing. And at this point, at 12 and now 13 years old, his upper jaw was done growing, but his lower jaw was still growing as he was starting puberty. So the lower jaw was getting bigger and getting further out in front of the upper teeth. And if we look at the center, you can see that the posterior crossbite, or the magnitude by which the lower back teeth were outside of the upper teeth, has actually gotten worse over that year. So certainly jaw surgery was an option here. Waiting for him to complete his growth and doing jaw surgery was a very viable option. And I warned the family that this was a possibility because, frankly, I don't know how much growth is going to occur. But if Connor was my own son, I want to do everything I can to avoid jaw surgery. You see, jaw surgery, while it's an ideal solution and can give somebody the perfect bite, it's invasive, it's costly, and it's not without risk. And so I resolved to do everything I could to help Connor avoid surgery, just as if he was my own son. So what did I do in my phase 1 treatment? Here's, by the way, is Connor right before we started treatment. You can really see that mandibular, or that lower jaw asymmetry, where his jaw is kicked to his left side. All right, so my phase 1 treatment consisted of a palate expander. So we were going to take advantage of the fact that at 13 years old, we could still expand Connor's upper jaw. We could make it bigger in a side-to-side way. We maxed out this expander, and so I used a palate expander to help influence the upper jaw. We also put braces on the upper teeth to help create space so that we could get these upper canine teeth to come in. And then we used a reverse pull face mask. So it's a type of headgear that pulls the upper jaw forward. And we use this commonly when people have underbites in our phase 1 treatments. And it pulls that upper jaw forward so that the upper teeth can hopefully get in front of the lower teeth. But we're doing that by influencing the jaw, not just the teeth. And so we did all this, and I'll show you where we ended up in Connor's treatment. So this is a side shot of the phase 1 treatment. You can see the braces. These are the hooks where we're being able to pull the upper jaw forward. You can see that we have the upper posterior teeth to the outside of the lower teeth. And I don't quite have the anterior crossbite or the underbite resolved at this point. Here's a shot in the middle of his phase 1 treatment of the braces and the expander, and you can see again we have that posterior crossbite resolved. We have the upper canine teeth coming in. All right, this is actually where I finished our phase 1 treatment. And again, you can see not much change in the back of the mouth right there. You can see that we have a much more aesthetic smile here. We still have some of that jaw asymmetry where the lower jaw is still out to the left side a little bit. Here we have the anterior crossbite somewhat corrected. I would have really liked to be better than this, but Connor's use of his headgear was waning, and so I thought that this was as good as I was going to get with his compliance, and I felt like whatever else I needed to do, I would do in our second phase of treatment. Again, here's his upper arch, fully expanded with the braces on there. All right, just as a little comparison of where we started and where we finished, you can see significant gains. The front teeth are looking great with that gap closed up. We have the canine teeth in. We have the posterior crossbite fully resolved. If we're looking from the side, we have significant improvement of the anterior crossbite or the underbite with these upper front teeth further forward. Excuse me. And we have a much wider upper jaw due to the palate expander. So I thought that overall we'd achieve some really great gains. I thought that we were hopefully out of the woods with any possibility of jaw surgery. And more than anything, I really just wanted to give Connor a psychological break from treatment. His phase 1 treatment took somewhere between 2 and 3 years. So at this point, he was 15 to 16 years old. And oh yeah, and to see his smiling photo. So big changes from when we started to the end of his first phase of treatment. So I wanted to give him a psychological break. I think it's important. However, I also knew that my time was running out to treat Connor before he left home and moved away. So in his junior year of high school, we initiated his second phase of treatment, which was comprised of Invisalign treatment coordinated with the extraction of his lower wisdom teeth. And I won't explain all about why the lower wisdom teeth came out, but essentially we were able to take those teeth out and then push the lower teeth backwards. So in phase 1, we brought the upper jaw forward with our headgear. But in our second phase of treatment, we were trying to bring the lower teeth backwards, again, to try to work on that anterior crossbite or that underbite. And so he had a fantastic second phase of treatment. Here he is at the end of his second phase of treatment. And it's really a testament to what a great Invisalign patient he was. He did everything that we asked him to do. He wore his aligners diligently. He wore rubber bands diligently. And so he was only in his second phase of treatment for 14 months. I tell everyone that great treatment is a partnership, and I was really impressed with Connor's ability to hold his end of the partnership. So the results that I'm going to show you here are quite impressive. Here's the center photo, which I'm so impressed that we were able to line up the middle of the upper front teeth and the lower front teeth. If I show you from the side, this is a near perfect bite. Actually, he has a little bit of an overbite here, and I purposely left him with a little bit of an overbite in case his lower jaw still grew. Now, I do have a mechanism after treatment to try to help prevent, even if his lower jaw grows, to try to prevent that anterior crossbite or that underbite from coming back by wearing some rubber bands with his retainers. Here's a remarkable change from where I first met Connor to the end of his second phase of treatment. Again, if we look at the side shot, this is when we first met Connor to the end of his second phase of treatment. So you can see underbite to even a little bit of an overbite. And quite the difference in the size and the shape of that upper jaw. Again, here's the change from Connor when I first met him to when we finished our second phase of treatment. And so this is quite a remarkable two-phase treatment. Now look, there are detractors that may point to a number of things. When you consider that Connor's first phase of phase 1 treatment, which was before I knew him, was 32 months long, so almost 3 years long. He had a 6-month break. That's when I came into the picture, and my phase 1 treatment with him was about 3 years, so just over 36 months. That's a long phase 1 treatment, but we were really trying to work on using that face mask to try to pull that upper jaw forward. And then we did a second phase of treatment for 14 months. So he was basically in orthodontic treatment for nearly a total of 7 years of treatment. And that is a long time. Look, I don't have many patients that are in treatment for 7 years total. It's not my goal to have anybody in treatment for 7 years. And so I can understand why a detractor might point to that length of time and be a little bit critical. But for those people who don't understand orthodontics, we avoided jaw surgery here. And so while it did take a long time, I am so pleased that we were able to avoid a costly, an invasive, and a risky jaw surgery and give this awesome result to Connor. And secondly, there are people that don't believe in doing multiple phases of treatment. So they don't like doing a phase 1 and a phase 2 approach. And I can certainly understand that there are probably some people that overtreat young kids, and it doesn't need to be done that early. But in cases like Connor's, 2-phase treatment can be absolutely incredible because we knew that we could influence the growth of that jaw when he was younger, and we knew that we weren't going to be able to influence the growth of that jaw later on. And so this really is quite remarkable that we were able to harness his growth and to avoid jaw surgery. So look, here's Connor when we were finished. And one thing that I'll say is with a long treatment, we certainly get to know our patients really well. And we got to know Connor amazingly well. And I'm so proud of him. I'm so proud of this result that we got. I am so proud of how well he did with his Invisalign treatment. And I am so proud that we were able to avoid that jaw surgery. So in conclusion, I'd love for you to take away a couple of main points. Number one, we want to see patients early. We like to see patients by age 7 or 8 because we want to be able to screen for those opportunities where we need to influence jaw growth early so that we can avoid surgery later on. Number 2, sometimes a first phase is necessary to correct growth issues. As you saw what we did in Connor, we used every bit of that reverse pull face mask or that headgear to try to influence his jaw growth in a positive way. And then number 3, I always believe in treating all of my patients like they're my own children. And I did just that with Connor. I certainly thought that with the asymmetry of his jaw, with the magnitude of his underbite and the magnitude of his posterior crossbite, I certainly thought that jaw surgery was a likely possibility. But if Connor was my own son, I was gonna try it non-surgically. And we did everything we could and we got this amazing result. And so I've always pledged to treat every single one of my patients like they're my own family members. And sometimes you get these really awesome results like this. So in conclusion, Connor was a great patient. He did everything we asked of him. And this was an amazing 2-phase treatment. I hope that you learned something about 2-phase treatments. And please let me know if you have any questions about this or how we can help you in either a phase 1, a phase 2, or just one comprehensive treatment. Thanks so much for listening.